Hello, everyone. So I'm Audrey, and we're back again for another Ask Your Asian Eye Doctor Facebook Live session. So August is Sight-Saving Month, and one of the things that hindi naman natin madalas sa pag-uusapan is strabismus or eye misalignment. It's more commonly known as pagkaduling o yung pagkakabanlag. So this afternoon, we've invited Dr. Norman Fajardo to talk about what it is, how it can affect vision, and if there are ways to treat or manage it. So if you have any questions, mag-comment lang kayo and we'll try to answer them all later. So before we start, of course, let me introduce Dr. Fajardo. So with us today is Dr. Norman Fajardo. He is Asian Eyes Pediatric Ophthalmologist, Adult Strabismus, and Cataract Specialist. So Dr. Fajardo obtained his medicine degree at the University of the East, Ramon Magsaysay Memorial Medical Center. He did his internship at UPPGH, and then he did his residency at the East Avenue Medical Center. He also completed his fellowship training in pediatric ophthalmology and adult strabismus at the Boston Children's Hospital and Harvard Medical School. He's authored several scientific papers, and he's an active member of the Philippine Society of Pediatric Ophthalmology and Strabismus, and he's a section head at the Children's Eye Clinic at PCMC, and he's also a volunteer ophthalmologist at the Ophthalmological Foundation of the Philippines. So hi, Doc. Good afternoon.
Hello, Odd. Good afternoon, and good afternoon to our audience.
Okay. So, Doc, let's get right to it. So, ano ba tong
Okay.
strabismus?
Okay, when you say strabismus, basically it's eye misalignment. So you can be duling, you can be banlag, you can have upward misalignment. One is up and one is straight, or one is straight and one is down. So, like as shown in the picture, when you say you're duling, you have esotropia. One eye is turned inward, and the other eye is straight. When you say you're exotropic or banlag, one eye is straight and the other one is going towards your ears. Then hypertropia, one is going up. Like when this child, the third picture, when he was looking to his right, the left eye turned out. So that's
Okay.
hypertropia. Then the last picture is the hypotropia. The one eye is going down. So it's pretty much obvious if you have an eye misalignment.
Okay. And then, Doc, it's important to notice that there's different kinds. So, just because meron kang misalignment, hindi lang siya isang klase lang. There are different kinds, and it's important to have it checked kasi, syempre, para malaman mo kung ano yung naman yung dahilan kung bakit ka meron ito.
Yes,
So,
correct.
speaking of that, Doc, ano ba yung cause? I mean, what would cause your eyes to be misaligned?
Let's differentiate, no? Childhood strabismus and adult strabismus, no? Meaning, matanda ka na, no? When you say you have childhood strabismus, usually it's thought to be genetics. It can be a lahi. When you say lahi, a distant relative might have it, okay? And you have a predisposition to develop strabismus because hindi nag-develop. It's generally called a sensory-motor imbalance. You cannot control your eyes coming from the feedback of your brain, no? Coming from the brain. Now, so there's a genetic predisposition to it. It can be associated with significant refractive errors or mataas ang grado. You can have cataract. Ibig sabihin, if you have cataract in one eye, then after a long time, it starts to deviate out or deviate in because that eye is not seeing. So you have to check it. That's part of the examination, especially in childhood strabismus. You may have, in adults, you may have mild stroke, like if you have uncontrolled diabetes or hypertension. You might have small strokes in the brain that may affect one muscle only. So you can have paralysis of one eye. That is an acute onset strabismus. Can be a lot of things. Can be also associated with hyperthyroidism, meaning there's an immune response to your thyroid, then it's cross-reacts in the eye muscles of the eyes. So nagiging stiff yung muscle na yun. So nagkakaroon ka ng eye muscle. So it can be anything. It can be a lot of things.
Okay. And then you mentioned, Doc, na pwede rin, kapag hindi kontrolado yung diabetes, pwede rin pala siya mag-lead to strabismus.
Yes, the way I describe it to my patients, especially adult patients, no, who have diabetes is hard to control because it's a psychosocial problem. So you want to eat, so everybody wants to eat, but in diabetes you can't eat that much. So you have the good sugar control. So the way I describe it to our patients, your blood vessel is parang kinakalawang if you have the uncontrolled diabetes. like the water piping, parang kinakalawang, and you have hypertension pa. That's a bad combination. You have high water pressure, and you have kalawang in your piping system. Pwede mag-burst ang iyong piping system or mag-clog because of that kalawang. So that's diabetes.
Okay. And then, Doc, as a parent, like, how would I be able to tell kung yung anak ko ba merong strabismus?
Often, parents will bring their children because it's obvious na may seems to be as shown in the picture. Okay. But there are smaller angle strabismus that are not obvious, or there are intermittent strabismus, like for example, in intermittent exotropia, meaning intermittently bumabanlag yung mata. So it's usually obvious in the morning when the child just wakes up, then it gets straight out. Or pag nakatingin sa malayo yung bata, lumalabas, diretso yung mata, unti-unting lumalabas yung mata. So those one of the more common manifestations, reasons for bringing the children or the child up for checkup because of those manifestations. For intermittent strabismus or intermittent exotropia, yung pagbumabanlag.
So, depende siya talaga. So, for a parent, kailangan talaga they're paying attention to
paying attention.
Sila nagpo-focus talaga pang diretso or parang merong lumilihis. So, mas ganun, Doc. So, maybe even when they're playing, that's
yes, like for example, I'm talking to you. Have you done your assignments? Lumalabas siya. Or while watching your children, watching TV at a distance, hindi makikita mo lumalabas yung mata. So those are signs that we need to watch out for. They do not usually complain. They do not say, "Ma, nagbabalag ako." They don't do it.
They don't know.
So it's obvious. We just need as parents. As I'm a parent as well, so I observe it in my children. So kailangan medyo, we pay attention to what we see.
Okay. And then, Doc, ang symptoms ba na napapansin mo sa bata, ganun din ang napapansin mo sa adults?
Ay different, no? Especially in adult strabismus, especially acute onset adult strabismus. They usually complain of double vision. Okay. Especially patients who had mild stroke or yung hyperthyroidism, they see double. So what's the difference? Why do children do not complain of that? Because a child's brain is still plastic. It's still developing, so it adapts. So if they see crossing, the brain will automatically shuts off one image coming from one eye. Okay. But in adults, since our brain are already formed, so we cannot just shut off that image. So we see double. That's the main difference between adult and acute onset strabismus, basically.
Okay. And then, Doc, kasi you were saying na minsan, hindi naman lagi na nagmamanifest na nagbabanlag or nagduduling yung bata. So, hindi siya required na consistent yung effect na yon for it to be considered strabismus.
So you mean hindi lumalabas?
Oo. Kailangan bang consistent na nagduduling yung bata?
No, it doesn't have to be. As I said earlier, there are types na intermittent strabismus. When I say intermittent, so usually, like yung mga banlag, intermittent exotropia nga, they are straight most of the time. But if they have poor attention, or they relax a little bit, or they're sleepy, or they're sick, lumalabas yung strabismus. Okay. Actually, if you call somebody, sometimes what I do when I have a patient who has strabismus na bata, especially the banlag type of strabismus, I check the parents in the examining room, and it turns out some of them may have strabismus, but not obvious.
Okay, very slight lang, kumbaga doon.
Yeah, very slight. Yun yung tinatawag na phoria. When you say phoria, it's not manifested. It's just there, but when you do the alternate cover test, lumalabas yung phoria. When you say tropia, ibig sabihin nagmamanifest yung strabismus, then intermittently talagang nagiging obvious. Tropic. Okay. It becomes obvious.
Okay. And then, Doc, pwede ba yung yung mukha lang siyang strabismus, pero hindi naman pala yung pseudostrabismus lang siya?
Yes, okay. So I mentioned there's a type of strabismus. It's not actually strabismus. It's parang kaya tinawag na pseudostrabismus, para siyang may duling. Like this baby in the picture, you can see that the corneal light reflex. So nakikita nyo, there's a white dot at the middle of the black part of the eye. Nasa gitna siya eh. So that means the eyes look straight. Pero the white part nearing the nose, on the left
Parang
eye,
nawala.
parang duling yung bata because
Mm-mm.
maliit, flat pa yung kanyang nasal bridge, tas meron siyang fold dito, okay, epicanthus, yung tinatawag na epicanthus. So para siyang duling. So that's a pseudostrabismus. But when you do the gold standard of checking if you have strabismus, is doing the alternate cover test like this. Dapat walang movement. Pag walang movement, you don't have strabismus. But if you have movement, gumagalaw yung mata, then you might have it. So that's how I test it. But many of the patients, or a small percentage of the patients who are brought to me or to us for pseudostrabismus, in about 7 to 10%, eventually develop strabismus, yung actual
Yung actual
salivary.
condition one. Okay. Okay. So,
There's a study for that, actually.
yes. So, in that case, mahalaga talaga ipa-check nila. If you're noticing it already, get it checked para lang mabantayan siya.
Okay. What I do, if I see patients with pseudostrabismus, I ask the parents to bring them back after 6 months to 9 months to recheck again, because usually during infancy, not all strabismus appear during infancy. They come out before 2 or 3 years old.
Okay.
Kung talaga magde-develop sila ng strabismus or eye misalignment.
Mm-mm. And then, Doc, you were saying na one of the important tests is yung check niyo yung alternate, kino-cover niyo one eye during the checkup. Ano pa yung other test na usually pagdadaanan ng isang bata?
Okay, so when they visit us or they bring their children to us at Asian Eye, we do a refraction.
Mm-hmm.
We check the grado. Then we do a visual acuity test. We check how the performance of the child when what they see. Pag infants, we see how if we cover one eye, does the baby respond to the object or pay attention to that object when it's presented.
Mm-mm.
We check the structure, the cover test. We check for stereo, if the patient can see 3D images. We check for the motor testing, the cover and cover testing, if there's an eye misalignment. Then sometimes we put eye drops. Actually, most of the time we put eye drops to check inside the eye if there are problems. Sometimes there are children who have bad eye problems inside the eye. So we need to check it just to make sure everything is okay.
Oo, para lang sigurado. Kasi hindi lang siya basta malinaw ba yung nakikita. Meron rin parang nangyayari sa loob that could affect their vision.
The picture shown now on the monitor, we're checking actually the back part of the eye using an indirect ophthalmoscope. Buti lang the child is very cooperative.
Oo. So siguro yun, Doc, kasi yun siguro ang concern ng mga parents na kanyari dadalhin nila yung anak nila, baka very stressful yung experience.
Okay.
Ano ba yung pwedeng gawin ng isang magulang para kapag dinala na yung bata, medyo primed, medyo prepared yung bata for...
So expect to have eye drops. Okay? Kasi ang critical dito yung eye drops, it stings a little bit eh.
Okay.
So the child might be get upset after a while. But there's a lot of psychology when you put an eye drop. You know, what we do is distract the attention. So I don't mention, sabihin ko sa patient usually, we're gonna put cold eye drops. So I don't mention the word painful eye drops or stinging eye drops or mahabding eye drops. We put cold eye drops para may kahit paano positive yung connotation.
Yes.
Then when you put the eye drops mahabding, then we massage the eye to distract. Actually, the massage will just distract that attention of the child from habding to the moving part of the eye. So I'm saying we massage your eye so that the cold eye drops will dissipate right away.
Okay.
Most often than not, they can tolerate it naman. So yun lang naman ang I think pinaka-issue doon. So but if the child is cooperative, sometimes I do away with the eye drops. It depends on how important for me to be able to see the back part of the eye.
Yes. Okay. And then, Doc, kunyari na-diagnose na yung patient na meron nga siya talagang strabismus as a child. So, nagagamot ba ito?
Okay. To be clear, there's treatment, but when you say cure, may ginawa tayo and hindi nababalik. Okay.
Okay.
Treatment can range from yung tinatawag na prism glasses.
Okay.
We can do eye exercises, yung tinatawag na orthotic exercises for small angle strabismus, like yung nagbabanlag, or yung maganda yung control. The control of the strabismus can improve with orthotic exercises or eye eye exercises. Okay, the one in the picture prisms, like Pag for smaller angle strabismus lang yun, yun ang application nun.
Okay.
Because you want to allow fusion of the image so that the brain will get used to one image. So we're
Ah,
training the eyes and the brain to fuse the image. That's the purpose of the prism and the orthoptic exercise to improve control of the banlag. But it doesn't mean that 100% or the strabismus will go away permanently. It
okay.
will just be controlled better by doing these exercises and this
Would
prism.
you say, Doc, na parang it strengthens the muscles in the eye also? Parang
Yes.
you're teaching it na ganito dapat yung
Yes.
gawin
So
natin.
but it's not necessarily a cure kasi a patient would always think, may ginawa tayo, it's going to be curative. Meaning when I define cure is when you give something and it will go away 100%. Hindi ganon. Just improve control so that the patient will develop binocular vision, meaning nagde-develop sila ng 3D vision.
Okay. And then, Doc, ito bang prism glasses, iba yung itsura niya from regular glasses or it looks more or less the same?
Medyo iba ng konti because there's a prism. It's a parang triangular glasses yun eh. It will
Ah,
trick the eye into seeing one image instead of two.
okay.
So, masasana yung brain to see well. This patient on the right, meron siyang mataas na grado. On the left part of the screen pala, you see, duling siya nung una, then when we put hyperopic or far-sighted correction, nagdiretso ng mata because na-relax yung focusing niya. In this case kasi, this patient has refractive accommodative esotropia, meaning it's related to the focusing effort of the eye. So we gave glasses to relax the focusing effort of the eye para dumiretso yung mata. Pag diretso kasi yung mata, the patient will, the 3D vision hopefully will develop well or normally.
Okay. So parang, Doc, siguro kasi I'm thinking about it, siguro in the way that kung paano nila explain sa bata. So in a way, the reason why you have the prism glasses, para ma-train yung mata to see one
Yung
image.
prism glasses are different from eyeglasses na hyperopic correction.
Yes.
The prism glasses will kind of trick the eye, the brain into thinking that they're seeing one image kasi di-displace ng prism yung image. So it's quite a difficult explanation, but basically, you want to trick the brain into seeing one image by manipulating the position of the image through the prism. Yung
So
eyeglasses will relax the focusing of the eye so that it would straight. So there are specific indications for using this prism versus eyeglasses versus orthoptic exercises or eye muscle. So depende sa diagnosis and sa kaso, sa
So in
condition
that
ng
case talaga, Doc, hindi pwedeng, kunyari napansin mo na parang nababandlag or naduduling anak ko, hindi ka pwedeng bumili agad ng present. You cannot do it yourself. You have to
Yes, you have
with
to
your
be
doctor
checked.
first.
And if it's appropriate, then we give what is appropriate. So if kailangan ng prism lenses, then we give prism lenses. If we kailangan ng glasses, we give glasses. Photo straight as far as strabismus is concerned. No?
Okay. And then, Doc,
Another thing, sorry, Odd. Another thing with glasses, when we give glasses, it doesn't mean when you say corrective glasses, it will cure the refractive error. It doesn't work that way. So hindi ibig sabihin pag nagbigay tayo ng salamin, gagaling yung grado o mawawala yung grado. Okay? The glasses will help a person focus and see clear image, but it will not cure the eye grade.
So you're correcting the image that they will see.
Correcting the refractive error, but not manipulating the size or dimensions of the eyeball para later on mawala yung grado.
Okay.
It doesn't work that way. Common misconception kasi yun eh.
Oo, hindi mawawala. Kino-correct niyo lang.
Yeah, it's not a cure. So most common misconception when you say correcting, it's curing it. It's not. It's just helping you see better. Natitreat yung symptoms, blurring of vision, or headache, yung mga ganon. But it does not modify, kasi yung eye grade natin depends on the size and shape of the eyeball.
Oo,
So
may
it's not
genetics.
gonna change it by using glasses.
Okay. And then, Doc, you said na minsan kasi orthoptic. So, those are like some exercises that they can do to help with strabismus. Kapag ang orthoptics, ba ni-recommend siya, kailangan yung doctor yung nagsasagawa nito or pwedeng this is something they can do at home?
Initially, when you say orthotic exercises, a doctor would see it. We have an orthoptist at Asian Eye, Dr. Guadato. No? I refer to him for orthotic exercises sa mga mata. For small angle strabismus, so that or adult strabismus that may nagde-decompensate yung kanyang eye misalignment, that can be improved with orthotic exercises. So initially, you're seen by a doctor, then you're referred, the Dr. Dato will give instructions on how to do the exercises. In most cases, excuse me, they give instructions, and there are certain sessions na kailangan present ka rin. Present din yung doc.
And then, Doc, meron din bang naitutulong yung Botox for managing strabismus?
Okay. In some other countries, yung mga infantile esotropia, sometimes we inject Botox into the muscle to relax it.
Okay.
To allow the eyes to, like for example, Duling. So we inject Botox dito sa muscle dito para mag-relax yung muscle, bumukas siya, dumiretso siya. Hopefully, yung sensory fusion niya, the ability of the eyes to fuse the image will take over so that it will straighten it. Okay? We also use Botox if there's an acute paralysis, like for example, na stroke, then daduling yung mata. Tapos yung mata dito, yung muscle dito hindi maka-function, so nakaduling, magko-contract yung muscle dito. Injection na namin dito para hindi manigas yung muscle. So pag nanigas kasi yung muscle, the strabismus can be permanent. Kasi if you have a stroke, the eyes can still straighten out. Pwede pa rin siya mag-recover.
Okay.
Then the Botox injection on that muscle can help recover the function of the other muscle.
Okay.
So in short, we still use both. We can use Botox, but mayroong specific indications, not all the time.
Okay. And then, Doc, you were saying, kasi nga, there are a lot of options when it comes to treating strabismus. Pero specifically for adults, ganun din pa. Are there cases na nagre-recommend ka ng prism glasses or
yes,
for adults?
yung mga stroke patients or yung mga patients with mild paralysis of the eye muscles, and because they're adults, acute onset strabismus, the brain cannot suppress the image coming from one eye. So we use prisms for them to be able to function. It's either they cover one eye para isa lang nakikita, or we put prisms on the glasses to trick the brain into seeing one image only.
Okay. And then, Doc, kasi syempre there must be cases na very severe yung experience of strabismus na patient. So, kapag ganon, kailangan surgery na mangyayari. So, batagal ba yung recovery nito? Paano ba ito ginagawa, Doc?
Okay. So, in large angle strabismus, we usually, and more constant strabismus, we usually suggest surgery, recommend surgery. Because when we do the surgery, the binocular function or binocular visual field, as far as function is concerned, can be improved. For example, have you tried driving with one eye? Ang hirap, di ba? Because your visual field is very restricted.
Yes, yes.
Now, if you're driving with both eyes open, yung visual field mo is very expansive. So you see more of wide angle if your eyes are straight compared to if you are one eye is deviated, then the angle, the expansiveness of your binocular vision is still small. So that's the functional objective of that. So we do the surgery for that to improve that function as well, apart from appearance, of course.
So ganun yung nangyari siguro dito, Doc, sa patient na to.
This patient, mga 50+ old teacher, no? So he has always been insecure about his appearance because, syempre, teacher ka, alam mo naman mga sometimes estudyante, mga loko-loko, di ba? So he decided to have finally surgery right away. He's very happy. So after surgery, I adjusted the muscle here. The eyes are straight. So he feels more confident about his appearance. So he's not that self-conscious about giving lectures afterwards. So, buti naman napasaya natin siya.
And then, Doc, kasi syempre nagpa-surgery ka na. Meron ka pa bang chance na bumalik ang strabismus nun pagkatapos?
Yes, there's a chance of recurrence. Long term, if you have good binocular vision, ibig sabihin nasana yung brain mo to see straight, then the long-term success of the strabismus is better. Okay? So in about 70 to 80% of the time, na-maintain naman na straight ang mata. But
Okay.
there are cases after a few years, many years, bumabalik significantly yung strabismus, lumalaki ulit.
Is it also because, Doc, syempre habang tumatanda, baka the muscles in your eye also weaken? May kinalaman ba yun?
Hindi naman, it's just there's a basic defect in the sensory motor balance of the eyes. Because
Okay.
as I said earlier nga, most of the strabismus, lalo na yung mga child onset strabismus, they have a genetic problem. When
Yes.
they were uh, when they were
When they were
uh,
born, gano'n na, Doc?
when they were young, they were parang assembled. Hindi nasanay yung kanyang assembly. Kumbaga sa ng kotse, inassemble sa factory, may
Oo.
konting defect yung kanyang alignment.
Gano'n,
So,
kumbaga gano'n siya talaga to begin with.
ganun siya talaga to begin with. So, we just do something about it. Then, hopefully, long-term, maganda yung control. But, there's always a chance of recurrence afterward.
Okay. So it's a matter of how do we extend yung effect na yon. So it's good siguro, Doc, na kapag merong ganitong condition isang bata, they get the surgery agad. So for a longer amount of time, they're able to enjoy yung binocular
Yeah.
vision,
The
yung
reason why we advise early surgery, actually, yung kung talagang manifest na yung strabismus, to in attempt to make the brain get used to using the eyes together at an early
yes.
stage
Mm-mm.
so that permanently masanay. The long-term control of the strabismus is better if the brain gets to use the both eyes together.
Okay. And then, Doc, kasi binanggit mo na minsan na for children, dahil plastic pa yung brains nila, kapag napapansin ng brain, parang, uy, bakit nagdo-double vision? The brain ignores yung image coming from one eye. And when that happens, that's yun yung sinasabi niyo, Doc, na lazy eye, ano? Yung ini-ignore niya kung ano nanggagaling sa kabilang eye that's causing yung
Okay.
double vision.
When you say lazy eye, strictly speaking, the vision of one eye is not as good as the other eye, despite corrective glasses. So it's when you say lazy eye, it's equivalent to amblyopia. For example, this is 2020, this is just 2040. You don't necessarily have to have strabismus to have lazy eye. Pwedeng mababa yung grado mo dito mataas. Let's say plus 100 to. Ito plus 500. Then this one, hindi na makaka-focus as good as the other eye. So magle-lazy eye siya or underdevelopment of the vision. In strabismus, if early on the one eye is duling and the other eye is derecho, then the brain will just use the left eye instead of the right eye. It's called
Mm-mm.
suppression. The brain will suppress image or ignore the image coming from this eye. Then pag ganito parating nangyari, baka hindi rin mag-develop yung vision on that eye. So what I'm saying is, pag may eye misalignment, it doesn't mean na may lazy eye or amblyopia. It doesn't also mean that if your eye straight, wala ka nang, you don't have lazy eyes or
Okay.
strabismus.
Okay.
Pwede yung amblyopia or lazy eye, mataas kasi yung isang grado, pero diretso mata mo.
Oo,
Okay?
oo. Nataon lang na may grado.
Oo. Or, you have alternating strabismus, minsan ito ginagamit, minsan left, minsan right, pero walang strabismus because the brain is using both eyes equally. So, the vision is parehong 20/20. So, you don't have lazy eye. Okay? So,
Okay. Okay.
ang important thing here is that child, the vision should be checked to determine if there's lazy eye. Then you have to check what is causing the lazy eye. Is it mataas ang grado? Is it strabismus? Is it cataract? Sometimes you have cataract na hindi na-detect. And all those things.
Okay, so at its core talaga, Doc, again, kapag merong to make sure na yung anak mo hindi magkakaroon ng lazy eye, it's a matter of getting them checked so you know kung 20/20 ba both eyes, meron bang refractive error,
Yes.
being nearsighted siya, farsighted ba siya, para maaga pa lang, parang maagapan natin para hindi siya dumating sa point na lazy eye na siya.
Usually, we advise checking the vision as early as 3 years old
Okay.
para to determine how the function. In other countries, vision check is legislated. So, there's a legislation in developed countries that children must have vision check before entering big school.
Yes.
Sa atin wala, but we're working towards it
Mm-mm.
for the government to be able to provide this facility for children to be checked, vision checked before school age
And
para
it's
ma-detect na early
Oo.
yun.
And it's important to kasi lalo na ngayon, a lot of the schools have reopened their online learning. So it's also a good time for parents to kind of keep in mind na baka kailangan na maipa-check yung anak nila. Especially kasi they're gonna be spending so much time nakaharap sila sa screen.
Yes,
And then,
yes. Para to make sure that
mm,
the eyes are functioning well.
mm. And then Doc, so specifically for lazy eye, ano ba yung signs to look out for para, kasi baka magkapareho lang ba some of the symptoms between lazy eye at saka strabismus or magkaiba sila?
Magkaiba. When you say, when you have amblyopia or lazy eye, one vision is poor, one vision of one eye is poor, and your eyes are straight. So you're not manifesting anything. So that it's important to actively test the child for this. But you cannot observe anything actually kung may lazy eye. Strabismus ma-observe mo, but
Oo.
lazy eye or amblyopia, you cannot necessarily. You have to check the vision or measure it using visual acuity testing to be able to find out if you have lazy eye.
Okay.
So, for us to be able to say you have lazy eye or not, you have to be checked. Your vision needs to be checked
Mhm.
in the clinic.
Okay. And then Doc, ang amblyopia ba sa bata lang or pwede rin siyang mag-develop later in life in adults?
No, since what I said earlier, as you mentioned, the child's brain is still plastic, still developing. Okay,
Mm-mm.
That's the main difference between a child's eye and an adult's eye.
Mm-mm.
Children, vision is still developing. Vision happens in the brain. It doesn't happen in the eyes. The eyes just receives information, and everything is transmitted to the brain. So we need to trigger that part of the brain by being able to deliver clear image using the eye. Dapat maganda yung nakikita ng mata para mag-develop yung visual center in the brain. In adults, develop na yung vision natin eh. Okay?
Mm-mm.
Unless meron tayong lazy eye nung bata na hindi na-detect at hindi na-treat. Therefore, dala-dala natin yun hanggang pagtanda natin. Kasi it was not treated. So, I see patients at about 20, 25 years old, poor ang vision. Pero kasi, hindi na-check nung bata sila.
Mm-mm.
So, the onset was during childhood, not adulthood. It's just that nagtuloy-tuloy lang until adulthood because hindi na-treat nung bata sila. That's why it is important because lazy eye is treatable at a very young age.
Okay. So Doc, kapag ganun yung kasi yung condition and then lumaki nga sila, they got older, they're in their 20s, whether they develop like a strabismus, it's really just a matter of getting treatment to see if
Okay.
possible pa siyang bumalik yung alignment.
If a person, an adult has lazy eye,
Mhm.
I'm not saying strabismus lazy eye
Lazy
muna.
eye.
I attempt to treat. Like for example, kung may grado, I give glasses, tapos pinapapatch ko, we try it for 2 or 3 months, but less likely mag-respond, but I still try it. Okay? Just
Just
to
in
give it
case.
a chance.
Oo.
Then after 2 months, I check again kung nag-improve ang vision. So
Okay.
by treating the cause of the lazy eye.
Okay.
In strabismus, like for example, an adult has eye misalignment, but the
Mm-mm.
onset during childhood pa.
Okay.
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 Then I can offer treatment. Usually surgical na kasi siya pag ganun.
Mm-mm. At that point kasi they're much older, hindi siya
They're
makukuha
much
ng
older.
therapy.
Lazy eye is treated or yung amblyopia is treated by patching one eye. Like for example, the left eye is poor or has lazy eye or amblyopia, the right eye is good. We patch the good eye to force the brain to use the bad
The
eye.
poor eye.
That's the treatment for amblyopia.
Okay. And then Doc, say na taon, merong isang patient na lazy eye, so which means yung isang mata niya could have a low eye grade or a high eye grade. Ang ganong patient pa, Doc, pwede siya mag-undergo ng LASIK para ma-correct yung vision niya?
Yes, depende yan If let's say mataas yung grado ng isang mata, but if you give glasses, like the 2020 or 2012, then it's beneficial to have that LASIK surgery.
Okay.
But if that eye, mataas ang grado ng left eye, pero hindi siya nagka-20/20 despite glasses, then even if you undergo LASIK, hindi mag-improve yung vision because the problem is in the brain. It's not in the eye grade already. Because
Mm,
hindi na-develop yung brain. So even kung mapababa mo yung grado of that eye with LASIK, the vision still remain. Poor pa rin.
ah,
Because hindi na-treat ng bata. But
yes.
if there's anisometropia, mataas yung isang grado, and ito, mababa lang, tapos na-treat siya ng childhood. Yung sabihin, nag-develop, na-treat yung amblyopia. Nag-patch ka, then you gave glasses. Nagka-20/20 to. No, pagdating niya ng 18 to 20 years old, you can have LASIK because the visual potential is good. So we see a lot of those patients na gano'n. Untreated anisometropia or yung magkaiba yung grado, but poor vision, then it's not advisable to have LASIK. But if you were treated during childhood, then you can potentially have good vision after LASIK, then we recommend it.
Okay. And then, Doc, binanggit ko kasi kanina na sa ibang bansa, mandated na kailangan 3 years old makapagpa-check up ang isang bata before they start school.
Vision check, yes.
Yes, a vision check. So, with us, when should a child be recommended to get a checkup? Kapag baby ba, pwede na siyang ma-check?
Actually, if there's a family history of retinoblastoma, if the baby, yung eye cancer, that's kunwari, if a parent had retinoblastoma when they were young, then dapat na-check agad yung baby as soon as you're born.
Okay.
If the baby was born very premature, then the baby has to be checked also for eye problems. If the baby has Down syndrome or other congenital problem, it is advisable to have an early eye checkup.
Yes.
To make sure that there is no other problem. Like, kasi a Down syndrome patient can have albinism or yung anak araw, or they can have eye refractive errors, yung mga ganun. So and they can have cataracts at a young age. So we need to check for that as well.
And then, Doc, yung binanggit niyo yung retinoblastoma, yung eye cancer, yun yung kapag pinicture mo yung bata, para minsan you can see it in their eyes, right?
Yung tinatawag na leukocoria or white pupil, ito yung nagkuha ka ng picture, then instead of the red glow, white glow. Okay? So it's called leukocoria, or white pupil. You may have cataracts, you may have retinoblastoma, and some other retinal diseases because of that. So it's not only retinoblastoma that causes the leukocoria, it can be childhood cataracts, retinal detachment, or other eye infections inside the eye.
So in a way, Doc, there's a benefit also to taking pictures of your child as they're getting older. Kasi may mga ganun palang pwedeng ma-pick up.
Do not switch off the, di ba sa camera, mayroong mga anti-red eye, yung red glow. Don't switch it off para you can see a red reflex. Then take another picture for that. Actually, there are gadgets that take that ROR using a phone camera. There's a program that you can download online.
Okay. So at least may options na, Doc. Like at least for parents, they just download it. They try it they try it for their child. Para at least meron ka konting peace of mind. Meron ka rin mapapakita sa doctor kapag pina-check up mo.
Yes, correct. Then, sorry, Odd. Sa strabismus pala, some patients would observe, parents would observe that, ito, anak ko parang may Duling or Banlag. Then I would advise, sana kunan nyo ng video. Kasi we all have cameras already that can record videos, no? So you can take the videos at home kung kailan mo napapansin yung manifestation ng problem. So that pagdating mo sa clinic, makikita natin yun. Or you can consult us online, video consult, and show it to us through the computer.
Okay. So at least, considering na naka-pandemic kasi tayo ngayon, a parent that is concerned na merong lazy eye o strabismus yung anak niya, pwedeng i-consult muna through teleconsultation.
We can do an initial video consult through our e-video to check if, give you instruction for the test, then you can perform it online and show it to us para makita namin kung meron talaga.
Oo. And then, Doc, meron na ba kasing features yung ating teleconsultation that will allow you to have better measurements or to get more information about yung eyes ng child? Like, ano tong virtual Hirschberg test?
Okay. There was a picture shown earlier about the Pseudostrabismus. Maybe we can pull it up. We can, yes. Okay. This is an example of a Hirschberg test. there's a light reflex at the middle of the black part of the eye. You can see the picture now. There's a dot, white dot
Yes,
there.
oo, may
That's
small white
actually the
dot.
corneal light reflex. So more or less, we can gauge if the patient has Duling or not. No, maybe
Okay.
you can show the picture of a Duling in the Banlag, the first slides that we showed earlier. Yung may isotropia and exotropia.
Oo. Yung several kinds of
I
strabismus.
think there's a corneal light reflex test there.
Oo, para at least
Ayan.
yan.
Nakita mo?
Oo nga, Doc. Wala
Doon
nga.
sa doon sa exotropia, obvious na obvious yung banlag niya, no? 'Di ba? You
Oo,
can
oo.
see
Yes.
the exotropia, the white the white dot is at the center on the right eye. Pero yung banlag nasa gilid siya, 'di ba?
Mm-mm.
Okay, that's how different it is. You can see the pictures. Tapos yung sa taas, yung sa batang may duling naman, there's a dot, white dot there. Tapos nasa gilid naman yung sa left eye.
Oo.
So that's the light reflex that we can do in the virtual Hirschberg test. That's a Hirschberg test actually.
Okay. So in that case, parang yun lang siguro yung maganda at least sa panahon ngayon kahit na hindi ka komportable na magpa-check up agad, you
Mhm.
can use yung teleconsultation as a way na masasabihan ka ng doctor at least, sige, check natin. It looks like
Yes, you
has
can.
indications na yun na talaga yung condition niya.
We,
Doon ka
yeah,
pa
we
rin
can give
check din.
instruction talaga. It can be
Oo.
done at home.
Yes. So at least may options. Again, Doc, it's a matter of making sure na kapag nangangamba na ng konting parents, meron siyang paraan to find
Ah,
out more. And then, Doc,
correct.
kapag naggawa ba, kasi sinasabi niya, bibigyan naman ng instructions yung patient, yung parents niya, how to do this test at home. Ano ba yung preparations typically? What would you ask the parents to do for the child?
Actually, I would ask them to have a toy, ready toy, para lalo na yung mga toddler age, yung mga 1 year old, 2 years old. You cover one eye using the palm of the hand para completely cover. Not this one, ha? Kasi pwede may gap eh. So you want them to cover like this. Tapos nagpa-present ka ng toy kung masusundan niya. And then the other one. This is how we check for visual attention.
Mm-mm.
We cover one eye at a time to see if susundan yung paningin. So, kung nakita nila at sinundan ng mata, then more or less you can say the patient can see. Diba? Then simple naman yung cover testing. So there must be a toy in front of you to catch your attention,
Yes.
or have the child watch a TV from a distance. Then
Cover mo
you
one
can
or
do
the
the
other.
alternate cover. In that sense, if I see a movement, I would say bring the patient to the plane para ma-double check. But if I don't see a movement, most probably wala. Then there are certain programs online that can elicit an ROR, red orange reflex. For me, that is very important at a young age because we can detect cataract, retinal detachment, or retinoblastoma inside the eye using the red orange reflex test, which is
Okay.
very important, I think.
Okay. O sige, Doc. At least now we know and parents know na meron palang ganon. And then, Doc, now we actually have a lot of viewers that had some questions for you.
Okay, good.
So first, siguro from Genevieve Saraspe, natural lang po ba sa infant na nagduduling talaga sila?
Okay. For the first 6 months of life, intermittently, you can have, minsan nagbabanlag sila. Pero dapat most of the time straight if they're alert na alert.
Okay.
If at a very young age or during infancy, the first 6 months, talagang hindi na sila dumidiretso, kailangan matingnan agad. Kasi it's a sign there's a problem at the back part of the eye.
Okay. And then, Doc, another question naman from Mimi. 29 years old po, nababanlag po yung right eye ko kapag nagugulat, biglang tingin at kapag sa malayo nakatingin. Anyway,
Yes.
po ba para maayos?
Yes, ito yung sinasabi ko sa'yo, intermittent strabismus. That they can grow up not knowing na meron pa lang silang strabismus, but at an older age, nag-decompensate na, meaning hindi na nila na-control yung kanilang eye alignment. So, nagde-decompensate na. Yeah, that can be helped with, I think, pag ganyan, I think si Mimi, meron siyang intermittent exotropia. These are the typical intermittent exotropia cases na pag nagugulat,
biglang
inaantok, bago gising, nababanlag, no? Nandiyan na yan nung childhood pa siya pero hindi lang masyado na obvious, ngayon lang nagiging obvious. Baka napupuyat siya sa Netflix o kaya sa Facebook.
Lalo na ngayon, Doc. Lalo na, hingip na relax sa mga tao. So, siguro, Miss Mimi, it's a good reason na para ipa-check up na natin yan. And then
Oo.
next from Miss Karen Lynn Fajardo Olieta. Good afternoon po. May I know what treatment is good for amblyopic eye for a 27-year-old po?
Okay. So, depende kung yun at 20 we can attempt to do patching to improve the eyesight, no? But the chance of that responding is very poor because developed na yung kanyang brain. So we're talking about vision, let's say hindi siya nagka 2020. Okay. But if the Karen has strabismus, iba pa yun, that can be managed through surgery.
Okay.
But if the visual function is poor and it was not addressed during childhood, then less likely that they will respond to treatment at 27 years old.
Okay. So again, mahalaga talaga maipa-check up yan at least once a year para sa mga bata. Kasi doon natin makikita, maagapan, pwede siyang ma-therapy agad para hindi tayo humantong sa point na wala na tayong magagawa or surgery na lang yung paraan para ma-treat ito. So yung next question naman natin from John Michael Madeja. Doc, yung natakot po ako at di pantay isa, maliit isa, malaki. Kita tuloy, duling. Nawawalan tuloy ako ng confidence.
So hindi pantay yung mata niya?
Isang maliit, isang malaki. So,
Okay. So depends yun may mga tinatawag na non-ophthalmic eyes. Ibig sabihin, pinanganak na talagang mas maliit yung isang mata. Then, yung isa normal yung size. Pag ganon, hindi siya nakakakita, sometimes we give glasses, magnifying glasses para magmukhang malaki yung mata. Parang cosmetic cover-up. But when you say hindi pantay na may misalignment, then titingnan natin kung anong cause. So that depends actually. But there's always a way to address it. If it's the eye is not functioning, then we can put artificial eye para lumaki or contact lens para mamukha siya malaki.
Okay, so that's
good. Nadadaya yun
Oo, minsan yun naman yung pinaka-concern kapag tinignan ka ng isang tao, so makikitang, uy, hindi talaga pantay, and it's not like nasa control mo yun So at least alam na ng pasyente na option, pwede maglagay ng artificial eye or a contact lens para magmukhang pantay ang mata. Okay, and then the next question naman, Doc, is from Chedil Custodio. Pwede po ba i-laser ang eyes with kids that are using glasses na may strabismus?
Okay. So, usually we don't allow LASIK in children because the eye grade will change over time. The primary care, actually, in adults, one of the primary criteria for undergoing LASIK, kailangan stable yung grado. You must have a stable eye grade para accurate yung laser mo. Bakit? Because the LASIK will not anticipate changes in your eye grade. So in children, we don't do LASIK because the eye grade will change over time because nag-iibay, lumalaki pa yung eyeball ng bata, nag-change pa. So there are very limited indications for doing LASIK in children. But for the most part, we don't allow it.
Wag muna, kumbaga.
For eye grade problems lang, walang problema. No LASIK.
Okay. And then the next question naman, Doc, from Ashy Ash. Exotropia, kapag po ba na surgery, maaalis na?
Like what I said earlier, the strabismus or misalignment surgery does not necessarily cure it, but it will improve significantly the strabismus. Meaning, lalo na for exotropia, magiging diretso yung mata nyo. Pero hindi ibig sabihin, 100%, hindi na siya babalik. Pero the long-term control of exotropia, ibig sabihin yung mata straight ng matagalan, it's about 70 to 80%. So, in 5 or 10 years, maganda pa yung alignment mo. But there's a 10, 20, or even 30% chance of recurrence na magkaroon ulit ng duling na malaki.
Okay. So, again, Doc, mahalaga na kapag nakita ng maaga, matreat na siya ng maaga. Kasi yun nga the longer amount of time na magiging pantay.
Generally speaking, you want the brain, because of a child's brain, you want the brain to get used to using the eyes together. Pag nasanay yun, mas maganda yung long-term control ng strabismus.
Ako to kasi iniisip ko siya na parang, 'di ba, sa normal na tao na walang condition sa mata, kapag kinover mo nga, let's say, napuwing ka in one eye, and you try to walk, mararamdaman mo yung parang hindi may mali eh. Yung hindi pantay yung road or you don't feel like diretso ka makakapaglakad. So, more so, kapag lumaki ka, na ina-assume ng brain mo either hindi niya ginagamit yung eye na yon or every so often, lumilihis siya. Kaya may ganong effect that maybe you're getting double vision.
In intermittent exotropia, yun yung intermittently nagbabalag siya. Kung maganda yung control, we don't necessarily need to do surgery right away. Basta maganda, diretso yung mata all the time. Kasi nagde-develop naman normally yung brain. But kung pumapangit na yung control o nagiging manifest na yung strabismus, meaning mas nagiging constant yung pagkaduling or pagkabanlag, then we usually advise surgery na para yung brain can get used to binocularity. Yung tinatawag na binocular. Ibig sabihin using both eyes at the same time together.
Oh, so parang yung kailangan magkasabay gumagana yung mata.
Oo. This is usually a high form of binocularity na tinatawag. Pag nag-develop ka ng 3D vision, yung 3D vision is a manifestation of cooperation of both eyes.
Okay.
You don't see 3D with one eye. You see only 3D with two eyes working together.
Dok, may tanong ako, kapag when we're talking about 3D vision, di ba for a while nauso yung mga 3D movies. So a person with a condition kung saan weak or may problema sa 3D vision, hindi may enjoy yung movie na ganon.
Yes. Kunyari, childhood pa lang, duling ka na, hindi na diretso, hindi mo makikita yung 3D when you get older.
Okay. So yun, at the very least, that's a reason to get it checked para yung mga movies na ganon, ma-appreciate mo.
Yes.
And then, Doc, ito interesting question to. Nung binanggit niyo po kasi yung Botox, ang tanong dito is, mawawala ba yung effect nun after a few months? At ilang beses pa siya dapat gawin?
Mawawala. Mawawala yung Botox, yung effect. Yung mga 2 or 3 months, wala na yung... Similar to mga cosmetic Botox, yung mga wrinkles. Mawawala din yung effect yun in 2 to 3 months. Pero the reason why we do Botox dun sa muscle, eye misalignment, para hindi manigas yung muscle. Kasi pag nanigas yung muscle, nagiging permanent yung eye misalignment. We just allow the Botox in strabismus is just to temporize. Ibig sabihin, it allow the eyes to recover first, especially yung mga paralysis. Pag naninigas yung muscle. So it just temporizes the strabismus so that mas maganda yung recovery later.
So siguro, Doc, is it similar to kapag na-stroke ka, usually one part of your body is frozen, like it cannot be moved. So sinasabi ng mga for rehabilitation specialists, you still have to move it even though your healing is not back. Kasi you need, the body has to get used na both sides of the body gumagalaw.
Yes, dapat yung counteracting muscle, kasi kunyari, nag-paralyze ako, nakaganito ako, so my muscles here are not pang-contra, hindi ko madiretso. Ibo-botox ko to para
mag-relax.
Mag-relax siya, tapos hindi madigas tong muscle dito until such time na ma-recover tong muscle dito.
Okay. And then, Doc, ito naman from Cheryl Torres Young. Do you recommend vision therapy as part of your strabismus treatment since you mentioned vision happens in the brain?
Yes. We generally, pediatric ophthalmologists, we don't recommend vision therapy. We recommend orthotic exercises for small angle strabismus.
Okay, and then because in strabismus surgery, it will only align the eyes physically, but not coordinated with the brain. So you have to have, if you're gonna have the surgery, your idea is, kailangan mo pa rin ng orthoptics to help make sure your eyes are working together.
If there are small angle strabismus remaining after surgery, sometimes we refer to our orthoptists to do exercises to still improve the control. But even the exercises and surgery is not a cure for the strabismus.
Okay, so ganon. So again, we still need to check first to find out kung ano ba talaga yung treatment na tama para sa inyo. And then earlier, yung question naman from Hazel, it's just how to treat lazy eyes for adults. Okay. You were able to discuss it earlier naman, Doc. Do you wanna recap for this particular question?
Okay. How to treat lazy eyes for adults? Okay. when you say lazy eye in adults, the onset was during childhood. We treat the lazy eye as early as possible. When we talk about lazy eye, Audrey, ito yung hindi 2020 itong isang mata, ito 2040 or 2050 lang despite glasses. I'm not referring to lazy eye because of strabismus. Magkaiba yun eh. Strictly speaking, 2020 isa 2040. Now, we treat the cause of the amblyopia during childhood for a better prognosis. But if the adult has lazy eye, which occurred in childhood, which happened in childhood, then the prognosis is poor already. Because dapat na-treat siya during the period of brain plasticity.
Oo. Kasi kumbaga nasanay na yung utak mo na gano'n na hindi niya na ginagamit.
Pag hindi na-address the cause of the amblyopia or lazy eye, then very poor prognosis. Now, if your Hazel is referring to strabismus in adulthood, then that can be treated also with surgery most of the time.
Okay. So
depende kung gaano kalaki yung strabismus.
Yes. So it's important again, kapag napansin na parang mukhang may grado yung bata, it's important you get it checked early. And then the next question naman is from Shana May Sarmiento. Baby ko po may ptosis sa right eye. Nerve 7 po yung nerve na nag-cause ng lazy eye. Maayos pa po ba yung eyes ng baby ko?
Okay. Ilan yung ano niya? May baby. Okay.
Yes. Baby may ptosis sa right eye.
Baka may cranial nerve palsy siya, ibig sabihin. Anyway, yung muscles of our facial expression is because is innervated by the cranial nerve 7. Okay, we smile because of the cranial nerve, the muscle. We close our eyes because of the cranial nerve 7. Okay, may tinatawag na cranial nerve palsy, may congenital cranial nerve, nakaganito siya.
Okay.
Kasi hindi mabuksan yung mata. Okay. Ngayon,
yung tanong is maayos pa daw.
Baka, okay. Meron kasi yung mga syndrome na tinatawag na nakaganon lang sila with naka-flat affect. Kasi affected yung cranial nerve 7. Tama ba yung picture niya? Oo. Mukha siyang meron siyang, kung siya yung gano'n. So mukhang may bilateral ptosis siya. Pag tinatawag sinasabi mo kasing congenital ptosis, hindi nag-develop yung muscle that lifts the eye.
Okay.
Okay? Pag cranial nerve 7 palsy kasi, hindi mo masasaran yung mata.
Okay.
Nakaganon lang. Cranial nerve 7. Hindi mo masasaran.
Okay.
Kasi yung cranial nerve 3, yun yung nagli-lift ng eyelid. So, okay. Ang tingin ko kasi para siyang doon sa picture ni Shana na anak, mukha siyang may bilateral ptosis. Ngayon, ang maganda sa ganito kasi pag bilateral ptosis, nagko-compensate yung bata, tumataas, nag-chin up.
Yes.
Para makakita.
Nahirapan siya so ililift niya where it's most comfortable.
So pag nagagawa niya yon, that's okay. Nate-temporize. We can address the ptosis later pag malaki na siya. Kasi ang more definitive treatment ng bilateral ptosis is yung frontalis sling. Kinukuha ng litid dito sa may hita. Tapos para i-lift yung mata ng gano'n.
Okay.
Usually, ginagawa yun 6-7 years old. Okay. Pero pag unilateral ang ptosis, kunyari ito nakaganon. Ito nakababa, ito nakabukas. So, hindi niya gagamitin to. That's more of a problem. Kasi nagagamit na niya to, hindi na niya magagamit to. Kasi naka-cover. Pag ganyan, as early as that age, ino-opera para i-lift.
Yes, para magsabay agad yung dalawang mata.
Para tumaas, para makakita. Kasi nade-deprive yung stimulation ng the left eye.
Yes.
Pag na-deprive yan, hindi magde-develop vision sa left.
Yung connection mula sa mata papunta sa utak.
So, hindi mapapadala na malinaw na insight. It's called a sensory deprivation amblyopia. Meaning, inuklud niya para siya may cataract na hindi nakakapasok.
Kasi hindi niya nagagamit at all.
So, kailangan i-lift using a suture para mag-lift. Pero in the picture kasi, parang dalawang mata, mukhang naka-lift siya, kita mo parang naka-chin up siya. Nag-assume ng chin up position to compensate, which is a good thing. That means nag-compensate siya.
Okay. In that case, siguro it's a very good idea for si Mommy Shana. Pa-check na natin to. Let's see. Para
masigurado talagang check.
Pa-check na po natin yan. And then next question naman from James Archie Odenya. Ano pong pwedeng gawin kapag banlag? Kasi nakasalamin po ako, pero parang double yung vision ko po.
Ano ang pwedeng gawin kapag banlag kasi nakapo ako pero parang double yung vision. So nakadagdag-double yung vision niya
Kahit
pag banlag.
nakasalamin, Doc.
Okay. So hindi nagsusuppress yung brain niya, meaning kaya double yung nakita niya. Alam mo, ang double vision, pwedeng as simple as grado lang eh. Ma-off lang ng konti yung salamin mo, yung astigmatism, lalo na yung astigmatism. Ma-off lang ng konti yung measurement
Oo. Magdodoble
ng
nga, Doc.
magdodoble siya talaga. So kailangan ma-check ano bang cause kasi ang sinasabi niya, nagdodoble pa rin niya pag nagsasalamin. No, baka may mali dun sa grado niya, kailangan ma-double check.
Oo. So yan, siguro another thing. Again, pandemic pa naman. Pero sa inyo, kay James naman kasi, very practical and it affects daily life na eh, yung pag-double vision. I'm sure it's stressful kapag nagda-drive ka or even nagbabasa lang you
Yes.
have that condition. So it's
Kailangan
better
ma-check.
check
Oo.
yan. Oo. Mahirap na. Nakasalamin na po kayo eh. So mas magandang maayos yung gradong nakalagay
Kasi
sa
baka
salamin.
grado lang ang problema, okay na. What do you mean?
Okay. So next naman, from Kelvin Makalisang Sepe. Kapag po pa nag-undergo ng surgery at makalipas ang ilang taon bumalik, pwede pa ba magpa-surgery ulit?
Yes, pwede pa. Alam mo, nung nagte-training ako, even a 70-year-old, when I was in fellowship, inooperahan namin eh. But she has had surgery twice.
Okay.
Kasi importante sa kanya, align yung mata niya.
Oo. Okay. So, good to know. Again, kasi yun yung fear eh, na nagpa-surgery na ako tapos bumalik rin pala. At least, that it means that there's still something that can be done.
Yes.
And then the next question from Maria Cristina Bellarmino Atienza. 5-year-old po twins ko, parehong wearing corrective glasses, 800 na grado. Mako-correct pa po ba? Duling po sila.
Like what I said earlier, mako-correct siya with glasses, but the glasses will not cure the grado. Okay. So, when I think yung 800 na yun, twin siya, hindi kaya premature yan. Kasi baka itong twins, premature, they are at higher risk for significant refractive error. Prematurity is a risk for significant refractive error. So, kung 800 yan, the glasses can help, allow them to see better and develop their vision, but it doesn't mean makikure ng salamin yung grado. So, if you're referring to cure for that grado, at this point, wala. Too early. Pag 18 to 20, they can have a refractive checkup with us and see kung papasa sila sa Lasik. Or yung tinatawag na implantable contact lens, yung phakic IOL na ginagawa ng ating refractive surgeon. That's also possible, pero yung ginagawa yun during adulthood already.
Kasi di ba Doc, sinasabi nyo nga na habang tumatanda, nagbabago pa kasi yung grado.
Yung bata habang lumalaki, nagbabago pa yung grado. So, dapat stable yung grado. They can have LASIK done at about 18 to 20 years old.
Okay. So again, siguro lalo for this patient, kailangan ma-check rin every year just to make sure na kung ano man yung corrective glasses na sinusuot, updated siya.
Pag ganyang grado, I check them every 6 months.
Ayan, yan. Yun pa.
Kasi mas masela niyan. And kung high myopic siya, the retina has to be checked regularly because yung mga highly myopic, nearsighted na mata, it's like an overstretched balloon eh. So yung lining inside the eye, the retina is thinned out. So you need to check regularly for problems on the retina.
Okay.
Kasi yung iba may problem pala sa retina that needs to be addressed right away. That can lead to retinal detachment.
Oo. So iniiwasan natin dito yung hindi siya mabantayan, Doc, tapos meron na palang retina problem.
Early detection.
Okay. And again, important to remember, kapag retina problem yun, kailangan pong ma-address na maaga kasi pwede siyang mag-lead to vision loss. Tama, Doc?
Yes.
So again, Doc, siguro we actually went through a lot of questions and I'm sure some people may mga gusto pang maghabol. But what would you advise, Doc, to our Facebook Live viewers? How can parents help protect their eyes?
Okay, so it's uso naman yung mga ano ngayon eh. We do it lot computer school, no, yung online classes. My advice is number 1, put the computer beside the window. Okay? So that during rest, they can look straight out para our eyes are more relaxed when we're looking straight out sa malayo. Mas relax yung focusing na mata. pag nakatingin tayo sa malapit, our eyes are constantly focusing. So doon pumapasok yung dry eyes,
Mm-mm.
doon pumapasok yung eye fatigue.
Oo.
So when your teacher tells you to
Take a
take a
break.
break by standing up and
Mm-mm.
looking straight out or doing some stretching exercises. Kasi napapansin, miski anak ko, nahuhuli ko, nag-YouTube.
Yun yung pang-relax niya. Oo.
Oo, nag-YouTube pa rin. So napapalitan ko. You know, nito. When you watching YouTube, you're supposed to be relaxing and standing up. Pero yung computer niya, nakadikit sa window so that they can look straight out to
Oo.
nature once in a while when they are, so that they can relax their eyes. And
Yes.
my advice is stretch out when the teacher tells you to take a break, stretch out, and do not watch YouTube
Oo.
during your breaks.
In fact, siguro if it's a live class siguro with a teacher, mas maganda pa, sabay-sabay kayo mag-stretch para
Oo.
interactive siya with other kids and making
Usually
them
ginagawa nila yon pag gano'n. Kaso yung iba during recess nag-YouTube.
Ah, ang hirap. Meron na nga ano, may outside na
Namo-monitor pa rin.
ginamit.
So
And then
gano'n,
Doc, mm,
place your child's computer beside the window and check them once in a while to make sure that they are resting, stretching out. Kasi important ng physical activity. Have a physical activity inside the house. They can exercise and dance para nade-develop din yung physical attributes nila, not only the brain but the physical attributes as well.
oo. Mahalaga yun,
Then
lalo na
if
ngayon.
if
Most
if you
kids are indoors.
if you see a sign of problem, you can call us or you can schedule an appointment at Asian Eye or any doctor that you know.
Mm. And then, Doc, if there are patients that want to see you, they want to get to consult with you, saan ba yung clinic niyo, Doc?
So we have clinics in Mall of Asia, Rockwell, and Trinoma. So maybe you can call the numbers on the
On the
screen
screen.
to have an appointment. Even with teleconsultation will be fine depending on the problem. You can check it initially.
Okay. And then, Doc, siguro, thank you so much for spending your afternoon with
My
us.
pleasure, actually.
Mhm.
I enjoyed it.
Okay. And then, Doc, siguro, say goodbye to the viewers that watch you today.
Okay, thank you for watching us. I enjoyed this session as much. I hope as much as I did, you enjoyed the session as well and learned something from it.
Okay.
Meron mga must know and nice to know. I hope we were able to clear up some misconceptions about refractive errors and amblyopia and the need for treatment of these cases.
Okay. Thank you,
Okay,
Doc.
thank you all.
Have a good weekend, Doc.
Bye-bye.
Okay.
Tama
And
ba
then,
yun?
for all the other viewers naman today, because we're in ECQ, patuloy naman ang aming teleconsultation service through Asian Eye Tele. You can avail it for as low as 300 pesos. So yung sinasabi ni Doc na kunyari meron ka ng pinangangamba ng problema sa mata ng anak mo, for as low as 300 pesos, give us a call. We'll schedule an appointment with Dr. Fajardo for you or any of your other Asian eye doctors. So call our hotlines. You'll see the numbers flash on the screen. We're also making it easy, syempre, to make it safe for you to restock yung mga medication, your eye drops, or even yung makabili kayo ng salamin for yourself or for your children. Pati contact lenses available na yon when you shop via asianeyeshop.com. So we ship nationwide and currently we actually have some promos. So free shipping tayo for purchases over 1,700 pesos, free upgrade din sa UV plus blue light lenses kapag bumili ng daily specs at kids specs frames. So lalo na sa mga bata, napapansin niya na kailangan nila ng salamin, it's good to have UV plus blue light para pati sa blue light protection, meron na po sila. We also have contact lens bundles. For people, minsan di komportable ang salamin, mas maganda mag-contact lenses for them, then you might as well get a contact lens bundles. Meron na kayong libreng contact lens solution with it. We also have a new promotion for this site-saving month. So if you buy dalawang Blefa gel, pwede ka makakuha ng one free Hayaback. That's savings of 683 pesos. And if you buy 5 Hayaback, you can get one extra free Hayaback bottle, another savings of also of 683 pesos. Both available from asianeyeshop.com and also at Asian Eye Clinic pharmacies. So whether you choose to buy online or if you're coming to visit us, may options po kayo to get these promotions. And if you want to try our services at discounted rates, meron rin tayong electronic gift certificates. So, kunyari, for your family, gusto mo magpa-check up, panahon na talaga, medyo matagal nang hindi nakakapagpa-check up, meron tayong family eye care package that offers a comprehensive eye exam for 2 adults and 2 kids for only 5,840. Yung maganda po kasi dito is that for this particular fee, kapag nagpa-check up kayo, optometrist, ophthalmologist na po kasama for this particular checkup. So at least malalaman nyo kung kailangan ba ng salamin o hindi. Check din ang overall health ng mata para malaman kung meron ba tayong signs of eye conditions, whether it's strabismus or some or even cataract or glaucoma. We also have a Lasik body package. We noticed meron mga tao na nagtatanong about Lasik for themselves or maybe for their children. So for those 18 and above, Lasik body package might be for you. So that's 2 Lasik screenings for only 4,000 pesos. That's a good savings amount kasi ang regular price natin ay 7,800. So and please note na hindi naman nag-expire ang ating GC. So kahit na bumili tayo ngayon, tapos ang gusto niyong palampasin mo ng MECQ, pwede pa rin po siyang gamitin in the next few months. And again, Asian eye clinics are all open to serve and take care of your eye health. If you need to get your eyes checked, please call your preferred clinic first to set an appointment. We have our branches in Rockwell, Trinoma, Mall of Asia, and Commerce Center, Alabang. You can also message us through our social media accounts para mas madaling magpa-appointment. So thank you so much for joining us this afternoon. We hope that you keep safe. Stay at home if you can, and if you're going out, please wear your face mask and face shield properly. Maintain social distancing and sanitize your hands frequently. And please get vaccinated when you can. So this has been your host, Audrey, and see you on our next Ask Your Asian Eye Doctor Facebook Live session next month. Thank you, everyone, and have a good weekend.